Thank you very much, Crystal. I hope you can see my slide and you can hear me clearly.
Yes, we can. Thank you. Go ahead.
Okay, thank you very much. Good day, everyone. My name is Natasha Mazonde, and I'm a research assistant at Priceless at the University of Witwatersrand in Johannesburg. And I'm presenting on online health communities' portrayal of obesity on social media platforms in South Africa. This study was actually part of my master's in public health degree at the Wits University, and I majored in social and behavior change communication. So for this study, I sort of like centered my results on the WHO's definition of obesity as a medical condition in which excess body fat has accumulated to the extent that it may have negative impacts on an individual's health, social, and financial outcomes. And globally, I found through the literature that obesity is considered as a major public health concern with a projected 1 billion obesity cases by 2030. In terms of in terms of the context in South Africa, I noted a high prevalence of obesity, particularly in women, as well as a growing prevalence of childhood obesity in South Africa, coupled with a growing focus on nutrition transition within the context of South Africa, both in rural contexts and urban contexts. And as a result, obesity prevention was identified as one of the key priorities. The social media context in South Africa, I focused on Facebook and Twitter. At the time of my study, Facebook and Twitter had the highest usership rates. And also I did note a high number of Twitter engagements within the context of social media. So these are the stats that just basically reflect in terms of the high usership rates in South Africa. And what's interesting to note here was that these figures basically covered an adult population as well as the child population. My rationale for the study, I did find literature that broadly categorized obesity or covered obesity, but in the broader media sense. There was nothing, I didn't find anything specifically focusing on social media portrayals of obesity. And I also did note through the literature that social media portrayals of obesity had the potential to inform media-based intervention efforts. My study was guided by the research question, how do online health communities in South Africa portray obesity on social media platforms? And I had 4 objectives. The first objective, I wanted to understand just basically what was the messaging, what was said about obesity on Facebook and on Twitter. Secondly, I also wanted to explore the sentiment that was carried within the posts and the tweets. Thirdly, I also wanted to get an understanding of the levels of engagement with the messaging around obesity. Lastly, I also wanted to get an understanding of who the voices were, who was actually creating and disseminating messages around obesity. So for this study, the definition of online health communities is groups or individuals with an online presence that create and disseminate health-related information, which can be used to gain understanding about a specific health issue. My study design was a cross-sectional mixed methods. I had both quantitative and qualitative content analysis of Facebook and Twitter platforms in South Africa. And my population was all the posts and the tweets that were shared between the 1st of July 2019 to the 31st of December 2019. That was a six-month period. And then in terms of data collection, I extracted data through Meltwater, which is a global media monitoring company that does social media analysis. I identified keywords, which I loaded onto the Meltwater database, and my initial search yielded 13.5 thousand posts and tweets. So in terms of my sample, my sampling was purposive. I based this on a diversity of voice and media reach, as well as the platforms. I just tried to make sure that I had a balance of the two platforms that I focused on. So my final sample was 275 posts and tweets. So in terms of analysis, I conducted a textual analysis as well as an image analysis on a selected number of posts and tweets. So for the quantitative analysis, I wanted to basically classify the voices, also classify the sentiments, and also have an understanding of the frequencies of the messaging, as well as also classify levels of engagement. For my content analysis, I wanted to get an in-depth understanding of the actual messaging, what was said about obesity, as well as getting an in-depth understanding on how the users on social media actually engage with that messaging, as well as how obesity was generally framed on the two platforms. I basically found my data was categorized into three broad themes. The first one being diet and food environments. And here I basically picked up a discourse that focused on high exposure to obesogenic food environments in South Africa. And what was also interesting to note here was a reference to the school food environments in South Africa's context. Secondly, obesity and other health risk factors. And again, here, the focus of the conversations around this theme made a lot of reference to the SSB text as a policy measure to address obesity, among other proposed interventions. And lastly, the theme around children and obesity. Again, the school food environments that issue came up again around this theme. And again, I think the other thing to note here was the reference in terms of the growing prevalence of childhood obesity in South Africa. That was noted in reference to the global childhood obesity prevalence. Sentiments towards obesity messaging, I basically classified that into three, where predominantly negative sentiments tended to dominate the data that I came across. And these negative sentiments focused around body shaming and fat shaming of individuals that were obese, or in this case, overweight. Whereas I noted the neutral sentiment covered posts and tweets that basically focused on just general information sharing around events that, for example, there was the National Obesity Week. So a lot of the messaging was neutral in the sense that it was just basically information giving with no specific slant against or in support of the health issue that I was investigating. And obviously the last sentiment was positive, that was 27% of the data that I looked at. And here there was a lot of positive body affirmation, individuals, as well as groups, Facebook groups and pages that shared a lot of body positive images around obesity. In terms of social media engagement, I noted that Twitter actually, with the Twitter platform, a lot of the content and messaging was actually initially generated from Twitter before it was actually shared to other social media platforms like your Facebook and your Instagram. And the other thing I noted with Twitter was that it actually, that platform stimulated more engagement compared to Facebook. And how I defined social media engagement, I basically looked at the number of shares, comments, likes, retweets in relation to a particular post that references obesity. Then in terms of content creators or the voices that actually created and disseminated obesity messaging, I categorized these into 6 broad groups. I had academia, health professionals, advocacy groups, news or journalists, government, and I had a broader category which I just named unclassified sources. This, according to my findings, had the largest in terms of generation of information. That particular group actually constituted 47% of the Facebook pages and the Twitter accounts that I came across. But unfortunately, some of the Twitter accounts and the pages that I came across were not, in terms of the names, I was not able to classify them into any of the other 5 categories. And it's just interesting to note that that was where the majority of messaging came from. And in this case, I think I just wanted to also mention that I did pick up a lot of social media influencers, in general, just individuals on social media with a very high online presence and following on both the platforms. And then in terms of framing of obesity, I basically generated 4 frames in which I categorized all the images and the data that I analyzed. The first frame was the stigmatizing frame, which focused heavily on negative portrayals of obesity. Fat and body shaming was the focus around that framing. And the second frame was around sedentary behavior. This one was in particularly reference to children in South Africa. And here the focus was around unhealthy eating behaviors, as well as lack of physical activities as some of the contributing factors to the rising childhood obesity rates in South Africa. And lastly, I had obesogenic environments. Again, the focus here made reference to unhealthy foods easily accessible to the general public in South Africa's context. The individual frame, the individual and lifestyle frame in South Africa basically focused on individual blame shifting, and that was mostly around dietary choices and lifestyle patterns of individuals who would have identified somehow on social media as being overweight or obese. So these were the conversations I picked up within the frames of obesity. In terms of my key findings, I do note that obesity is definitely, through the social media portrayals, a complex framing. There's a complex framing of the health issue because obviously of the multiple causes of obesity that have been highlighted through the social media portrayals. And my data, dominantly stigmatizing portrayals, did come up across more dominant as compared to the other framings, particularly on Twitter. And definitely the sentiments were mixed throughout between the 2 platforms. And then I also did note that the engagement was both interactive, and in some cases it was also very passive, where you just find a few number of likes on a particular post or a tweet without necessarily engaging with the content or commenting further or sharing of the content. Again, the voices were diverse across between the 2 platforms as well. So in terms of the significance and implications of this study, I do note that the social media discourse, it does highlight complexities on the multiple causes of obesity. And then again, through the study, South Africa is witnessing a growing trend of obesogenic environments and nutrition transition. And in my view, this study also did highlight an urgent need for continued efforts to address obesity. And lastly, a lot of misinformation around obesity was highlighted through this study, particularly around the stigmatizing portrayals of obesity. In terms of recommendations, I feel there's a need for health professionals to increase their online presence, particularly on social media. And I think this would be to address particularly the misinformation that is prevalent on social media. And secondly, health practitioners can also leverage social media for media-based interventions around obesity prevention, as well as just general health education and promotion around obesity. And lastly, I feel there's a need for multi-sectoral efforts in co-creating prevention interventions. In this case, what I had in mind was a scenario where you've got health practitioners or health developers, program developers, actually engaging with the social media influencers, as well as the celebrities with the very high following on social media, to co-create and design media-based interventions that are targeted at obesity prevention. Thank you very much.